My name is Robin Davenport and my presentation is on mesothelioma. What is mesothelioma? Mesothelioma is a tumor of tissue that lines the lungs, stomach, heart, and other organs. Cancerous mesothelioma is the most common form of cancer. Here's some history. The history of mesothelioma is limited because of the small number of cases. The earliest record of tumors on the lining of the lungs came in 1767. It wasn't until 1909 that J.G. Adamine coined the term mesothelioma to classify the rare cancer. Mesothelioma is linked to asbestos exposure in the 1940s. Most people with malignant mesothelioma have worked on jobs where they breathe the asbestos in. Usually this involves men over 40 years of age. Others have been exposed to the asbestos in the household environment, often without knowing it. How much asbestos exposure does it take to get mesothelioma? An exposure of as little to 1 to 2 months can result in mesothelioma 30 to 40 years later, and in some cases as much as 70 years later. People exposed in 1940s, 50s, 60s, and 70s are now being diagnosed with it because of the long latent period of the asbestos disease. Here's some signs and symptoms. Some of the symptoms experienced in the advanced stages are shortness of breath, chronic pain, fluid buildup, bowel obstruction, and unintentional weight loss. Prognosis. Like most cancers, the prognosis for this disease often depends on how early it is diagnosed and how aggressively it is treated. Unfortunately, due to the latent period of time, it is often too late, and many will succumb to the disease within 1 year of its diagnosis. So because the exposure to the asbestos can be like lay dormant, it can take a very long time for the signs and symptoms to start to show up. So like later on in life, you can be exposed as in your younger years, and then it would like come up later on. There are 4 stages. Stage 1, mesothelioma is present in the right or left lung and may involve the diaphragm on the same side. In stage 2 of mesothelioma, it invades the chest walls, and it can also invade the esophagus as well. The esophagus, the heart, or both of your lungs. It also can affect your lymph nodes in the chest and may also take over. Stage 3. Mesothelioma has been the mesothelioma has penetrated through the diaphragm into the lining of the abdominal cavity or the peritoneum. Lymph nodes beyond these in the chest and may also spread to other organs. Stage 4. At this point, there is evidence of the cancer in the bloodstream and throughout other organs. Treatment. It is only 3 ways to treat mesothelioma. 1, surgery, that's to take out the cancer. 2, radiation, which is therapy using high doses or x-rays and other high energy rays to kill the cancerous cells, or chemotherapy, which is trying to use drugs to fight the cancer, to wipe it out. And that's my presentation.